Okay, so now we're going to talk about record review. And this is going back to that acronym I mentioned earlier, RIOT. And so this is the R in RIOT, record review. When we're looking at a record review, what we as assessors are doing is we're looking at the history of the child. We're trying to learn more about what happened up to this point. And so while we're doing our record review, we're going to look for teacher information in the form of report cards or notes that have been added to the cumulative file. We're also going to look for disciplinary information and learn more about any sort of disciplinary pattern or behavior pattern. Additionally, we're likely going to contact the school nurse just to learn more about any sort of consistent visits or medical problems that might have existed or been reported that we're not aware of. And the nurse is also going to do an interview and a report with the family, and that's just a standard part of a psychoeducational assessment, especially an initial. They'll also do a hearing and vision screening. So likely the family will already have contact with the school nurse as part of this assessment. Additionally, with the record review, if a child has already been eligible for special education for some time, or even if they're newly eligible in an area such as speech and we're assessing for additional areas, we're going to look at previous IEPs as well as old reports, including psychoeducational and speech and language reports, as well as any other reports that might exist. Something that's very important with the record review is that we are in constant communication with parents and that any outside reports that have pertinent information for the school be shared with the assessor. And the reason that's important is because if a student has been assessed outside of the school setting and has been found to qualify, for example, a student who has a diagnosis of autism through Kaiser and receives in-home applied behavioral analytics services, the school team should know about that because one, it will help us to make sure that we're considering those outside reports and the contents of those reports and how the outside assessor came to their conclusions. And two, it helps us to make sure that we're collaboratively getting information from family and possibly from outside agencies, such as the ABA agency. Now, when we do these sort of collaborations, we are never going to just seek out information without parent permission. So what you may see is something called a release of records that comes to you as a parent, where we're asking for permission to contact certain people who may have worked with your child, or agencies who may have done assessments, or agencies that provide services outside of the school. And again, the reason for this is so that we're being collaborative and we can learn more about your child and how they're doing even in the home setting, and use that information to help us to complete our assessment in the school setting and to learn more about what things may work or help your child in the home setting, especially if we need help supporting your child in the school setting. So it's a really good thing to be collaborative and open. Now, you don't have to share those reports, but if you have them, in order for us to consider them, we have to see them. And so I highly recommend that any parent who has an outside assessment report provide that to the school district or to the assessor directly so that they can use that information as part of their assessment reports. Okay. What about an interview? When we're thinking about interview, what we need to remember is that interview is going to look different for a psychoeducational assessment as opposed to maybe like a teacher parent conference or just a conversation. It's going to be very direct and it's going to have a lot of personal information that's included. And so I always like parents to have that knowledge up front so they're not feeling like their privacy is being invaded. But when we're doing these assessments, especially when we start to get to the older ages, and especially when we're dealing with social and emotional challenges, we may ask questions like, does your child have a drug addiction? Or is your child using medication? Do they have outside diagnoses? Are they receiving therapy? And these questions are very important for us to ask and get answered because they help us to build, again, a comprehensive picture of the student and to learn more about their challenges and possibly about ways that they're dealing with those challenges outside of the school setting. In the interview, it's really important to just be honest. And sometimes parents can't remember things like developmental milestones. So sometimes I interview parents and they can't recall when their child first sat up or first crawled or said their first word. That's okay. Just be honest with us. And let us know if you have like a general idea of when those milestones were hit, and we can report that you don't exactly remember, but you have a general idea and you feel that they were all within a normal timeline. Or not, you don't remember, but you do know that they were slow or less developed than expected by the age at expected. And that's okay. I mean, when I had to do my parent report for my son's assessment, I had to go back and find his little baby card and so I could, get the proper weight, and also so I could remember certain things about his APGAR scores, because I don't just have that knowledge here. So I had to go pull his little baby file and look it up. And that's okay. It's normal. So just be open and honest about that as well. This interview is not limited to parents, so we're also going to talk to your child directly to learn more about them. When I interview a child, a lot of times I'm asking questions about how they get along with others. I want to get their perspective on school, how they like their teacher, what's challenging about their school or their teacher. I'm asking them about friendships. I'm trying to learn more about how they get along with family members. Also, I may ask them questions about medication or doctor's appointments or therapy. And the reason I do that is because I want to have an understanding of whether or not they're aware of some of the challenges they may have. And if that's something you're not comfortable with, then I'm happy to talk ahead of time with you or with the family to learn more about that. And so, what I mean to say by that is, if you're uncomfortable with some of these interview questions for your child, make sure that you have a conversation with the assessor ahead of time, because the default is for us to ask these kind of questions so we can get to know more about your child. When we're interviewing the teacher, we're asking questions about how the child's doing in class, maybe learning more about their challenges and their weaknesses. And this is not based on testing, it's based on teacher report. We're asking about work completion. We're asking about how behavior has been in the class, how are social skills, do they have friends? Can they follow directions? Are they completing work? So we're asking a lot of different questions to learn more about that teacher perspective about the child and how that looks at in the school setting. And that's really important because, again, we want a multifaceted view of the child, and we want to make sure that we're learning about this kiddo from multiple people, not just from one lens. And when we get these multiple views, we can bring them together to paint a more comprehensive picture of the student. So I will come back with 2 more areas, and I hope you're ready.